to say something that might surprise you coming from a psych nurse practitioner, but I think medications are overprescribed. I think there's something that's handed out too quickly, without enough conversation, without enough context, and without a real plan for what comes next. I think they have also been very helpful and saved lives, and I know that they have because I've seen it happen. So, both of those things are actually true. I think the reason so many people are suffering either from untreated mental health issues or from fear of the treatment itself, like medications or being judged in an appointment, is because no one's really willing to say both things out loud at the same time. And that's what this video is, just my honest take after more than 20 years as a nurse and in the psych field. I think that the fear is real and I think that it makes sense. If you're afraid of medication, I want you to know that's not irrational at all. There's a lot of noise. There are a lot of real stories of people who felt worse on medication, who struggled to come off of it, and who felt like they weren't even heard by their provider. And those stories are all true and valid. They happen. And the mental health system has earned a lot of that skepticism, to be quite frank. So if you've heard that medications are handed out too casually, you're not wrong. Here's what should happen and what I do in my own practice. Before I consider medication, I want to understand your whole picture. I want to know about your sleep. I want to know about your nervous system. I want to know about your patterns, your history. I want to know whether this is a situational anxiety issue that is causing problems for you right now. Maybe therapy or lifestyle changes might be more beneficial for you and might address it more directly. I also want to know if there's trauma underneath this anxiety and mood changes that medication alone won't really touch. So, medication is not a substitute for understanding what's happening in your system. It's a tool. And like any tool, it works when you know what you're actually trying to fix. So, for some people, medication creates just enough stability that real work can actually become possible. Therapy lands differently. The nervous system can actually calm down and start to integrate new patterns and thoughts and behaviors. And the human being can show up in their life like they couldn't before, right? In a way that they wasn't possible or they weren't able to. And for others, it's a little bit longer term support, and there's nothing wrong with that either. Your brain's an organ. We don't tell people with thyroid issues, just, oh, white knuckle it, do the best that you can without the medication, because taking it long term means that something went wrong with you. And the goal is always, what does this person need at this point in their life to function and heal? So the part that doesn't get said enough is this part. Some medications are difficult to stop. Some of them can cause discontinuation syndrome, dizziness, irritability. Some people describe it as brain zaps, emotional instability. Those are all very real. And it's not the same as addiction, but it is physical and it can be hard to come off of medications at times. So, what that means is that starting a medication is a decision that deserves a real conversation, not fear, an actual conversation with your provider. You should know going in. How will we know if this is working? What does a taper look like if we decide to come off? What's the plan if I don't tolerate this? And it's important that you ask your provider to have that conversation with you because you're entitled to that information. And a lot of us welcome those questions. It just shows that you're engaged, and you typically, if you're more engaged, you have a better outcome. So, the bottom line from someone who has been doing this for many, many years now: medication is not poison, but it's also not magic either. It's a medical intervention with real benefits and real risk and real variability from person to person. It's not all dangerous, and it's not always the answer either. What you deserve is a real conversation with your provider who will sit with you long enough to figure out what you really need, who will explain the reasoning, who will monitor you, who will adjust it if something isn't working or you're having a lot of negative side effects, or if you're doing really well, and talk with you, not at you. I hope this helped you sort through some of those feelings. Like I said, medication is a tool. I don't feel that everyone gets medication when they come in to see me. Some people, it's not appropriate. It's just not going to be helpful and appropriate. And some people, it is going to be helpful and appropriate. But it's important to have the conversation. And if you do decide to start medication, it's a real conversation that needs to be had. How long are we doing this? What's it going to look like? How will I know if it's working? How will I know if it's not working? What do we do if it is not working well? What are the side effects? What are the long-term effects of coming off of this? How long will I be on it, etc.? I think those are very real and valid questions. And I like to have those conversations with my patients A lot of times people aren't prepared for that conversation when they come in, and there's nothing wrong with that, but I feel like you need to be able to make an educated decision when you come in. And education revolves around the pros and the cons, the risk and the benefits for you, and what that looks like for you in your day to day life. So you're allowed to ask questions, you're allowed to have concerns, and you're allowed to take your time, and you're also allowed to get help. I hope that was helpful for you. Please like, subscribe, and share if it may be of help with someone that you know.